In fact, it's maybe worth saying at this point as well about where it's at in the UK in terms of research. I know you know about the NICE guidelines and those kind of things. It's maybe worth just briefly mentioning that there's still so much of a focus on a psychiatric side to it,
Yes.
without looking at it, before we come to some specific areas. Maybe just briefly speak to that.
I think because for so many years, standard tests just show that there's nothing wrong with the patient, with ME patients. The diagnosis of ME is a diagnosis of exclusion, which means there isn't a blood test or a particular thing that you can get a positive or negative. It is, well, the medical professionals looked at everything it could be that could explain your symptoms. Nothing showed up. Therefore, by default, you have chronic fatigue. So because that's gone on for so many years and that was the history of it, that's kind of why it led towards being, it must be psychiatric, because we can't find anything organically physiological happening. So, and unfortunately that is still, because of all this confusion, the paradigm shift required in the approach to the research and the approach to the illness, it's still, and also all the differences, like, so there are subgroups to actually get repeatable studies that can be done and redone with groups of patients, that we're way off on the physical side from that yet. We need to identify subgroups, we need to replicate those studies. So on the physical side, there isn't enough evidence to justify the NICE guidelines being updated to include those yet. So all we're kind of left with is the stuff that is, on the, psychiatric based approaches really, which was CBT. And yeah, so we've got some way to go.
I know you mentioned to me recently a survey that was done of patients' feedback of
Yes,
what they said was helping them, and maybe it's just worth commenting on that as well.
Yeah, there's the charities know this. They've done studies of their own members and asking them what was helpful, what was unhelpful. There was one study that comes to mind in 2001 from one of the charities where they asked how helpful was CBT, and I think that was like less than 10%, and about graded exercise, and it wasn't very good either, and 50% got worse doing graded exercise, and then there was looking at complementary therapies, including dietary changes, and there was some sort of 60-70% improvements and so on. So, but again,
and that's also just a whole, people do all kinds of different things, nothing specifically targeted, but generally saying that it is a benefit.
Exactly, and the conclusion being, and it's in the NICE guidelines, you can see them online, that patients, they've reported that patients are saying these are helpful, but there needs to be more evidence to prove these. So, the NICE guidelines say, yeah, patients are saying it's helping, but we're not going to recommend them, we're not going to give them on the NHS because there's no proof yet.
And so, I suppose it's such a different paradigm of how to look at the whole thing.
Yeah.